This module will cover lower extremity dysfunction at work. Lower extremity injuries at work are commonly related to improper lifts or improper transfers. These can be easily avoided with simple mechanical changes. As mentioned in previous modules, these injuries should be of great importance to you because of their ability to disrupt your personal life. A major lower extremity injury at work can impede your ability to fulfill daily tasks and participate in the hobbies you enjoy. The most common workplace lower extremity injuries include meniscus tears, plantar fasciitis, Achilles tendonitis, and knee ligament sprains. While we will specifically discuss these injuries, know that the techniques we discuss can also help to prevent various other hip, knee, ankle, and foot dysfunctions. Lower extremity dysfunctions can be generally broken down into three categories: traumatic injuries, tendonitis/overuse, and degenerative changes. Traumatic injuries include ligament tears, meniscus tears, sprains, and fractures, among other things that usually happen with a sudden quick movement and subsequent injury. Tendonitis and overuse injuries happen from repetitive motions that overwork certain muscle groups. This can happen from large lifting tasks such as moving heavy materials in a factory, or a more simple maneuver such as using a foot pedal on an assembly line job. Degenerative changes make up most of our long-term aging-related changes. As we age, everyone is going to develop some level of arthritis in most joints. The large majority of people, however, can avoid pain related to arthritis and degenerative joint disease by following some very simple recommendations. Staying in good physical shape will help to limit the degenerative changes you experience at work. How do we prevent traumatic lower extremity injuries? The most important thing is to avoid lift and twist maneuvers with poor posture. We will get into this more in upcoming slides. Some of these injuries are what we would call freak accidents and are largely unavoidable. Meniscus injuries, while often considered traumatic, are amongst the most common workplace lower extremity injuries and are largely avoidable. One of the easy ways to prevent meniscus injuries is improving lift and twist mechanics. A lift and twist is when you lift a load and then need to return and place that load in another area. Think of a 2x4 coming off of a conveyor that then needs to be placed on a rack off to the left. Start by placing your feet shoulder width apart while facing the load. Grab the load and lift. Pre-position your foot towards the target. This will make it so you are not twisting on your knee. A lift without pre-positioning your foot in a rotated position will lead to a shearing force through the knee and is the most common mechanism of meniscus injuries. Preventing tendonitis and overuse lower extremity injuries involves very simple recommendations that are very effective. If you work a job with lots of repetitive motion tasks, you are at risk for lower extremity tendonitis injuries. If you have one of these repetitive tasks, you must first try to make changes to the setup of the task and make it more optimal for your body. Along with this, try varying your posture and positioning throughout the day. Things that you have learned in previous modules can help with this. Posture variety is key. Recall the recommendations in the shoulder section. Try to limit how high you lift, how far away from your body you are holding the load, and limit how heavy the load is when possible. These were originally taught for the shoulder section, but are applicable to the lower extremity as well. Some additional recommendations include placing a rubber mat at your workstation if you are standing in one place on concrete floors for a long period of time, wearing good shoes or boots, staying faithful to the workplace micro stretches that will be given at the end of this section, and wearing inserts if deemed necessary by a physical therapist. Preventing degenerative lower extremity injuries is not usually going to happen primarily at work. In order to prevent these types of injuries, it largely starts at home. Maintaining good strength through a structured fitness program. Low impact exercises such as walking is great at improving aerobic health as well as lower extremity strength and flexibility. Adequate footwear at work can help to lessen the stress on your ankles, knees, and hips. If you are not sure what to do to get started on a prevention program, consult a physical therapist or even a personal trainer to get you started on an exercise program that works for you.